the issues facing our healthcare system today are issues of quality and cost, or as I like to say, the intersection of cost and quality. That we are not where we need to be. We don't appear to be heading where we need to be, and I don't think there is anything either in the legislation or in the planning stage that will definitely or reliably get us where we need to be. So I think what we needed to discuss today, and which we have made a tremendous beginning, is what changes need to be done, and how can these changes be accomplished, and what elements, what sectors need to be involved, motivated, and engaged to accomplish what needs to be accomplished. Define what needs to be done, and let's get a path to get it done. Left to its own devices, with the aging of the population, things are not going to get better on their own. We need to address the twin issues of cost and quality. We need to address the issue of the shortage, an increasingly worse shortage of primary care. And there are several approaches that we have been discussing that show promise. One is more care management and care coordination at several different levels. Two is more cooperation and integration between the disparate elements of the healthcare system. Three, focus on individual patients or members or beneficiaries, depending on your perspective, and collaborate on what's best for the individual as opposed to the overall system. Look at the incentives, what we pay for, and how we pay for them. Address the incentives and find ways to better pay for and better finance medical care and medical outcomes, but recognizing in the process that payment reform and payment incentives alone are not the answer, that they have to be part and parcel to changes in infrastructure and better handling of healthcare data. Take the various elements of the healthcare system, the payers, providers in the broadest sense of the word, and policy groups, academics, consumers, and bring them all together and find points of commonality. There's been an awful lot of conflict between these disparate elements, pretty much as long as I can remember. But the truth of the matter is, we have a lot more points of common confluence than we do points of conflict. We shouldn't focus on the points of conflict, which will be there, but if we focus on the points of commonality, of common interest, which are considerable, we can probably accomplish a great deal. Well, just bringing the people together helps. The discussions that we've heard and the way they've been facilitated has been outstanding, and we have, in fact, we do in fact find common ground, and there has been some focus here, not just on what are the problems, but what are the processes to make things better, what are the metrics to measure things, and how may we get to a better place. It's not just bemoaning that's going on here. It's really focused on the positive. Well, I would like to think that the meeting itself is not the end of the process. That it will be the catalyst to a process that will continue to evolve and continue to help us get somewhere. I think this has been a good beginning, and I think we need to see something like this more than an annual event, but form groups that will work together across the segment lines, and I think we have made a beginning in that regard. We'll see how well that works out.